As school employees, it is important for us to be ready for any emergency that could affect our schools. A growing concern to health officials nationwide is the possibility of a pandemic flu outbreak. A pandemic, by definition, is an infectious disease outbreak occurring over a wide geographic area and affecting an exceptionally high proportion of the population. Pandemics typically occur about 3 times a century. While it is impossible to predict when we will face the next pandemic, experts agree that day will come. The effects of a pandemic can be reduced if we prepare. The most infamous flu pandemic occurred in 1918. People in many Michigan communities thought public health officials were overreacting in their warnings about the possible impact of this particularly virulent strain of influenza. That outbreak eventually claimed millions of lives worldwide, including thousands in our state. During a pandemic, the illness emerges as a new flu virus for which people have little or no immunity and spreads easily from person to person. A pandemic lasts much longer than normal flu outbreaks and may include waves of influenza activity lasting 6 to 8 weeks and returning months later.
St. Clair County Health Department works with its health and medical community partners. This also includes veterinary offices and the schools in collecting information in regards to individual cases or clusters of outbreaks of suspect or known disease that we're trying to keep a close eye on. It is essential for the school systems to be involved in this with their weekly reporting system because the schools are an important sentinel site to tell us what is going on in the community and how we're going to need to react to it.
The health department reviews these reports to identify spikes in normal disease numbers and clusters of unusual symptoms. Reporting your school's illness-related absences is very important. Often, the person charged with the responsibility of reporting is the school secretary. It is absolutely vital for schools to document symptoms of student illnesses as accurately and completely as possible to assist the health department in tracking disease numbers. For example, if a parent calls to say her child won't be in class today because of the flu, the person taking that call should attempt to determine if it is indeed flu, whose symptoms affect the lungs and respiratory system, and not gastroenteritis, which is often mistakenly referred to as stomach flu. If a school relies on an answering machine to record the absence, it is recommended that you remind parents to be specific about their child's symptoms. If you are unclear on your school's reporting procedure, contact your building principal. Schools will be directly affected by a pandemic. As any educator knows, children are among the highest at-risk population for illness and also the most likely group to spread disease. A widespread outbreak could lead local health officials to close your school. The local public health officer would work with school leaders to decide if and when to close and reopen schools. The closings would be handled like any other unscheduled event, such as a snow day. But more likely, some warning would come ahead of time as health officials study illness trends and the path of outbreaks. Health experts recommend that school leaders revisit their school's emergency plans in response to a pandemic. Some items to consider: staffing. What staff members should continue to work? When would they work and where? Notification. Identify key contacts, including the person who will be the point person in communicating with the public. Make sure your fan-out notification list is up to date. Education. If students have to stay at home for a period of weeks or longer, alternate learning methods should be part of your plan. Consider ways you may use television, radio, email, or the internet to provide lessons during a pandemic. While the local health department would make the decision to close school, it is our responsibility to create ways educational programs could continue. Coordinating efforts are underway amongst the Michigan Department of Education and Health to help create these plans. Communication. How would you communicate with parents before, during, and after a pandemic? Consider listing your communications plan in your school newsletter, mailing it to parents, including it in your student handbook, and posting it on the district's website. During a pandemic, your school buildings themselves may play an important role. It is likely that the health department would identify centralized locations of sufficient size to create temporary clinics to administer vaccines or provide treatment. Your school may well be the perfect site for such a clinic. It's important to realize that while antiviral drugs and vaccines can help an individual fight the flu, They have significant limitations during a pandemic. Most importantly, we must realize that the vaccine can't be produced until the virus is identified and could take months to produce and distribute. This fact makes it even more important to emphasize prevention and planning. If a pandemic occurs, personal hygiene will be one of the most effective tools to prevent spreading the virus. A pandemic flu strain is spread like any other flu. Droplets are sprayed into the air by coughs and sneezes. These droplets are infectious in adults from 1 day before the infected person exhibits symptoms to about 5 days after symptoms set in. This means it can spread very easily. You can take common sense steps to limit the spread of flu. These steps are helpful now, but they are critical in a pandemic.
Some common sense tips that we can remember to help keep us healthy. The first of these would be to wash our hands frequently throughout the day, certainly after you cough or sneeze. Keeping your hands away from your face is another good measure. Covering your cough or your sneeze with a tissue and then throwing that tissue away and washing your hands, or if a tissue isn't available, coughing into your elbow or your shoulder. Staying home when you're sick and staying away from people who are sick. Keeping your immune system strong by eating right, getting enough exercise, managing stress, getting enough sleep, and finally by getting a flu shot.
You can also share with your school's parents and their families some things they can do to prepare for the possibility of a pandemic by reminding them to have a family emergency plan, adequate amounts of food, water, and to keep a small amount of cash on hand. Pandemic flu planning checklists for individuals, families, schools, and other organizations can be found on the Centers for Disease Control's flu website at www.pandemicflu.gov. Being prepared in the event of a pandemic is critical to the well-being of our community. Your local ISD or RESA and local school districts are working with health officials and emergency responders to prepare to respond should such an event take place. For more information about pandemic flu and how your district can prepare, please contact the Emergency Preparedness Division of your local health department. Help everyone stay healthy by being informed and prepared.